Hello, this is Dr. Dyer from Texas Size Smiles. I want to tell you a little bit about the Glidewell snore guard appliance. Now, this is the adjustable metal hinge Glidewell snore appliance or sleep apnea appliance. This is designed for mild to moderate sleep apnea patients. It's fully adjustable. Some of the things I like about it are, number one, the way the hinges are designed. It's very durable. A lot of other snore guards have the hinges that you see, or the elastics or plastic connectors oriented from here down to here. Now, at this kind of orientation instead of this kind that you see here, that seems to help a lot. It seems to take a lot of stress off of these hinges, and we have a whole lot less breakage problems with these than we did with the ones that are oriented the other direction. They would commonly break around these hinge apparatuses. One thing that you have to do, that's an additional thing, that is put an elastic on here. On the other designs, you don't have to use the elastic, but the elastic helps keep your mouth closed, keep your mouth from hanging open and breathing through your mouth as much through the night. So it is helpful with that. Now, what this comes with, let me kind of go over everything. It comes in this nice presentable box here that you can give to your patients, and the 3D printed models or your stone models come with it, and I usually give those to my patients in case they break it, so they can bring it back and have them and repair it. So it also comes with the AM aligner, and you've probably seen these before, but the AM aligners are something for them to bite on in the morning after they take it out, and full instructions. So there's patient instructions for use, which is really nice, and doctor's instructions for use. So be sure and read these over real well before you see your patient. They're relatively simple to deliver. This AM aligner that comes with it, basically you put them in boiling water or really hot water, and you only put it down to this first tab right here, that much submerged in the water, so that your handle is not affected. And then once it turns to a clear appearance, you take it out of the hot water, you put this tab against their upper front teeth and orient it from side to side in their mouth. Once you get it lined up where you want it, then have them just bite into it. So you want to have them bite into their normal centric occlusion. Your patients to bite in this for a few minutes after they take out their snore appliance, and it'll help get their bite aligned back where it was the night before. So this is not required necessarily. Most people do fine without it, but if you need to have it done, then this is it comes with it, so you might as well use it. That way you don't have to worry about that problem if patients ask about it. Now, as far as adjusting the appliance, it comes with a little screwdriver, so I'll show you how to adjust it real quick. So I normally want to start out at the end-on-end position, and that's usually a pretty comfortable position to start with. So kind of look at it and kind of line up your lower and upper teeth so they're end-on-end. If your patient has a lot of allergy problems and they have a hard time breathing with it, what I've done before is just add a little bit of acrylic right in here above the the lower cuspids, so make a little comfortable round bump. So when they close down, that's the only thing that hits, and that leaves kind of a little crack area in the front for them to breathe through. I've done that with my wife. Don't tell her I said that. So when they bite down, it only hits the front, but it also gives them something. If they're a grinder, helps them, gives you the anterior stops that you need to help prevent grinding from posterior teeth touching. So that leads me to the next point. So when they bite down, I'll usually put marking paper in here and have them bite down and rub it together. If there's a lot of heavy occlusion on the back, you need to remove that. So if they're grinding on the back and there's lots of bite problems back here, you can kind of swing this out of the way like that. Just take an acrylic burr and trim it down. So you want to see anterior biting only. You don't want to see any biting on the back teeth, because that can stimulate grinding at nighttime. The hinges, if you pull on them, see how they come apart. So that's the reason for the elastics, but it also helps keep the mouth closed a little bit more while they're sleeping. But mainly it's to keep these hinges where they're supposed to be. So to adjust these, it's really pretty easy. You put the little screwdriver in here and you'll feel it fall into a screw, and you can turn it different directions. So if you go counterclockwise and put some pressure on it while you're adjusting it. So you go counterclockwise, you see these lines right here that tells you, kind of gives you a guide to tell you how far you've adjusted it. So I usually turn it like this. If you turn it clockwise, you can see it opening up more. So you want to do the same amount on each side. Look at it and see if the teeth look like they're end on end. So I'm going to start out with 2 millimeters. Take a look at that. So that's pretty close to getting the inside of the ledges end on end. And that's a good place to start. When you put it in, have them put upper arch first, and then have them move their jaw forward and bite into the lower. If they have a hard time moving their jaw forward that much and biting into it, then you've advanced it too far. But if you have them bite into it and it feels pretty comfortable position, then it's a good place to start. And then you can, if you want to, you can show your patient how to adjust it themselves and how to advance their jaw further. So I tell my patients this is the volume control. So if their spouse or the partner tells them that they're still snoring a lot, then they can take this, and you can tell your patient to only advance it 1 millimeter at a time. Don't do too much at a time, but do 1 millimeter further advancement. Try that out, and then get a report after a week or so. And then if they're still snoring, advance it a little bit more. It's important to do it slowly so they don't have a big shock to their muscles in their jaws. Be sure to read the instructions, or make sure your patient reads the instructions. So the patient's instructions are pretty thorough, and it does talk about them adjusting it themselves by using the screwdriver to advance the jaw. As far as cleaning, no denture cleaner, no bleach, no mouthwash, no ammonia. Don't let it soak in water. Don't use toothpaste with any brushing device. So basically, you're supposed to use a 3.8% or less peroxide-based appliance cleaner. So you can Google this, and several products come up that you can buy on Amazon. I like the Aligner Bright, the little tablets that you just drop in there. They're peroxide based, and it's important that they know that they're supposed to rinse it off after cleaning it and let it dry.